Which of the following actions should a CCMA take to verify the quality of venipuncture supplies before a blood draw? A. Check the needle gauge size. B. Confirm the expiration date. C. Confirm the physician's order. D. Ask the patient to inspect the tube. Answer: B. Supplies such as collection tubes and needles must be checked for expiration dates to ensure sterility and integrity. Expired materials can lead to inaccurate results or patient harm. What is the primary purpose of performing an eye irrigation? A. To dilate the pupils. B. To remove foreign objects or chemicals. C. To assess visual acuity. D. To detect glaucoma. Answer: B. Eye irrigation is used to flush out foreign bodies, debris, or chemicals, reducing irritation and preventing further injury. Which of the following is part of the proper procedure for cleaning EKG equipment after use? A. Use alcohol to clean all leads. B. Wipe with a bleach-based solution. C. Spray disinfectant directly onto the machine. D. Dispose of electrodes in a biohazard container. Answer: A. Leads should be wiped with alcohol after each use to prevent cross-contamination. Electrodes can usually be discarded in regular trash unless visibly contaminated. A patient is visibly angry and refuses to answer questions. What is the most appropriate action by the CCMA? A. Leave the room and return later. B. Document the refusal and report to the provider. C. Call security for assistance. D. Argue calmly with the patient. Answer: B. The CCMA should document the patient's behavior and notify the provider. This ensures patient safety and accurate charting without escalating the situation. What is the correct angle for inserting the needle during a venipuncture? A. 45 degrees. B. 90 degrees. C. 15 to 30 degrees. D. 5 degrees. Answer: C. A 15 to 30 degree angle is optimal for venipuncture. It allows proper access to the vein while minimizing tissue trauma. Which of the following terms refers to a legal document that a patient signs to authorize a procedure? A. Patient chart. B. Informed consent. C. HIPAA waiver. D. Treatment plan. Answer: B. Informed consent is a document that confirms the patient understands and agrees to the procedure, ensuring legal and ethical compliance. Which of the following actions ensures chain of custody during specimen collection? A. Wearing gloves throughout. B. Using sterile containers. C. Labeling the specimen in front of the patient. D. Sealing and signing the specimen with time/date. Answer: D. Maintaining the chain of custody includes documenting the time/date and securely sealing the specimen, especially in legal or forensic cases. What is the term for listening to internal body sounds with a stethoscope? A. Palpation. B. Percussion. C. Auscultation. D. Inspection. Answer: C. Auscultation involves using a stethoscope to listen to sounds like the heartbeat or lung sounds during an examination. Which of the following is a CLIA-waived test commonly performed in a physician's office? A. Blood culture. B. Complete blood count. C. Rapid strep test. D. Liver function test. Answer: C. The rapid strep test is simple, has a low risk of error, and is approved under CLIA-waived guidelines for use in non-laboratory settings. A CCMA measures a patient's temperature at 100.6 degrees Fahrenheit orally. How should this be classified? A. Hypothermia. B. Normal. C. Febrile. D. Hyperpyrexia. Answer: C. A temperature above 100.4 degrees Fahrenheit is classified as febrile, having a fever. Hyperpyrexia is usually above 104 degrees Fahrenheit. Which of the following injections is administered at a 90-degree angle? A. Intradermal. B. Subcutaneous. C. Intramuscular. D. Intravenous. Answer: C. Intramuscular (IM) injections are given at a 90-degree angle to ensure the medication reaches the muscle layer. Which pulse site is most commonly used in emergency situations? A. Radial. B. Femoral. C. Apical. D. Carotid. Answer: D. The carotid pulse is used in emergencies because it is easily accessible and reflects central circulation. What is the proper action if a patient begins to faint during a blood draw? A. Continue drawing and finish quickly. B. Elevate the patient's legs and stop the procedure. C. Call 911 immediately. D. Restrain the patient. Answer: B. Stopping the procedure and elevating the legs improves blood flow to the brain and helps recover from syncope, fainting. Which document outlines the expected behavior of medical professionals? A. Code of Ethics. B. OSHA Manual. C. Job Description. D. Mission Statement. Answer: A. The Code of Ethics guides professional conduct, ensuring patient-centered care, confidentiality, and respect. Which of the following medications is used to treat bacterial infections? A. Acyclovir. B. Ibuprofen. C. Amoxicillin. D. Insulin. Answer: C. Amoxicillin is an antibiotic effective against various bacterial infections. Acyclovir treats viral infections. What does the term hematuria mean? A. Blood in urine. B. High glucose in blood. C. Decreased red blood cells. D. Painful urination. Answer: A. Hematuria refers to blood present in the urine, which can indicate infection, trauma, or other urinary issues. What is the proper action when a sterile field is contaminated? A. Ignore and continue. B. Clean the contaminated area. C. Replace all sterile items. D. Ask the patient for permission to reuse it. Answer: C. Once a sterile field is contaminated, it must be discarded and replaced completely to maintain sterility. A CCMA documents a patient's chief complaint as headache for 2 days. What part of the chart is this information recorded in? A. Assessment. B. Objective. C. Plan. D. Subjective. Answer: D. The subjective section includes what the patient reports, such as symptoms or concerns like headaches. Which of the following steps should a CCMA take when measuring blood pressure? A. Inflate the cuff to 120 mm of mercury. B. Place the stethoscope over the radial artery. C. Deflate the cuff quickly. D. Ensure the arm is at heart level. Answer: D. The arm must be at heart level for accurate blood pressure measurement, otherwise, readings may be skewed. Which of the following actions is correct when applying a Holter monitor? A. Shave chest hair if necessary. B. Place electrodes on bone. C. Instruct the patient to avoid movement. D. Remove electrodes daily. Answer: A. Shaving excess chest hair ensures good electrode contact and accurate recordings during Holter monitoring. Which organ is primarily assessed with an abdominal palpation? A. Liver. B. Heart. C. Lungs. D. Brain. Answer: A. The liver, among other abdominal organs, is evaluated during abdominal palpation to assess for enlargement or tenderness. What is the best site for capillary puncture in infants under 1 year? A. Heel. B. Thumb. C. Index finger. D. Big toe. Answer A. For infants, the heel is used for capillary collection due to underdeveloped finger capillary beds. When reinforcing teaching about medication dosage, what should a CCMA do first? A. Tell the patient to ask the pharmacist. B. Read the drug information sheet. C. Check patient understanding with teachback. D. Refer to drug handbook. Answer C. The teachback method ensures the patient understands instructions by having them repeat the information back. What is the typical paper speed for an EKG machine? A. 5 mm per second. B. 10 mm per second. C. 25 mm per second. D. 50 mm per second. Answer C. 25 mm per second is the standard EKG paper speed. This ensures the waveform interpretation aligns with clinical norms. Which color tube top is used for a complete blood count, CBC? A. Blue. B. Red. C. Lavender. D. Green. Answer C. A lavender top tube contains EDTA and is used for hematology tests like CBC.